I used to be very thin talaga. Thin, with regular menstruation. But late 2015, sometime around December or November, I was diagnosed with PCOS. That time ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglycemia, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw akong aparador, mukha na daw akong gasol. Aside from the hypoglycemia, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARS?
Nalaman ko siya through Ms Jansen and Mr. Jhen. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excusin, mom, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARS, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday, nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nilang, hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduced na yung size. So, working on it para ma-clear na siya. So, first of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh kung ano yung nangyaring changes. Good morning, I am Monique B. Marzad, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypogly, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Before pregnancy, I'm already taking PPARS. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARS tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARS. So, because I've read and heard that PPARS helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the 3rd day onwards, I was actually feeling better. After giving birth, we're gifted with PPARS, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARS also. And I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, no, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARS. My husband and I were taking PPARS tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that could also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARS. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, no, falls apart, no? Sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was in the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung Simply Nature PPARS. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARS, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPARS sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, ang sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6. 6 ngayong May. So that would last for ilang months po. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Ang papayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARS. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simply Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simply Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So I'm very, very thankful to Simply Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simply Nature. I trust Simply Nature.
Good evening, everyone. I'm Sheila, and welcome to another episode of Simply Healed webinar. This program is proudly brought to you through the collaborative efforts of Simply Nature International and Simply Healed Medical Group, united by a shared mission to support healing through education and science-guided care. This Nutrition Month, Simply Nature is proud to champion the power of purposeful scientific nourishment. As a trusted name in wellness, we specialize in highly quality supplements sourced from a unique strain of microalgae known as PPARS. This research-backed nutritional approach aligns perfectly with the lifestyle proactive health, widely recognized for its ability to support cancer patients, boost immune function, and optimize metabolic health. Reclaim your vitality this July by choosing nutrition that truly makes a difference. Hi, everyone. If you or someone you deeply care about is walking through the journey of chemotherapy right now, I want to start by acknowledging something vital. You're incredibly resilient. We will map out the core focus, which is supporting your body and protecting your foundational health during chemotherapy. Our discussion is built around two essential pillars, which the patient well-being. First, we will explore practical ways to enhance your energy and vitality, looking at how gentle movement, intentional rest, and clean nutrition can help fight treatment-related fatigue from the inside out. From there, we will shift our focus to managing nausea and supporting your appetite. Sharing simple stomach friendly strategies like utilizing ginger, managing environmental scents, and opting for easy to digest foods to keep you nourished and comfortable. Above all, we want to emphasize that these natural approaches are meant to beautifully complement your standard care, which is why we always urge you to coordinate with your doctors before making any big difference or changes to your daily routine. We all know that while chemo is a remarkably powerful weapon in destroying cancer cells, the collateral damage it leaves behind can feel like an entirely separate battle. The crushing bone deep fatigue that sleep cannot seem to fix, and that constant draining nausea that robs you of your appetite. It is deeply exhausting. It's completely normal to feel overwhelmed. It is equally normal to look for safe, natural ways to help your body cope alongside your prescribed medical treatments. The idea isn't about replacing your treatments, it's about how we can support your body at the foundational cellular level. We want you to look at how we can help you protect your healthy cells so you don't just survive your treatment cycles, but actually maintain a better quality of life throughout the process. To understand how to fight the side effects naturally, we have to look what is happening inside the body. Chemotherapy is systemic. It targets rapidly dividing cells. While it goes after the cancers, it also temporarily impacts healthy cells in your gut lining and bone marrow. This cellular stress is precisely why you feel so physically wiped out and sick to your stomach. This is where the breakthrough concept in natural cellular health comes into play, PPARS. Now, if you haven't heard this term before, PPAR stands for peroxisome proliferator activated receptors. You can think of them as master switches living inside your cells. They are responsible for regulating your metabolism, keeping inflammation in check, and managing how your body produces energy. When you are undergoing chemotherapy, your body is in a state of massive oxidative stress and chronic inflammation. This internal chaos is what triggers the heavy chemo brain and compromises your digestive system. Natural PPAR agonists, which are highly concentrated in specific, nutrient-dense microalgae strains like Chlorella sorokiniana, act like a perfect key that unlocks the cellular switches. By introducing these natural activators, we are helping the body to do three critical things simultaneously. First, it down-regulates inflammation. By calming the inflammatory response on your gastrointestinal tract, it gently eases the persistent low-grade nausea and helps soothe your stomach. Second, it revitalizes cellular energy. PPARs directly stimulate your mitochondria, the literal powerhouses of your cells. This helps your body convert nutrients into actual, usable, physical energy, helping you lift that heavy blanket of fatigue. And third, it aids in cellular defense and detox. It supports your liver and kidneys as they work overtime to filter out the heavy waste products of medications. Navigating cancer treatment is an incredibly personal day-by-day journey, and there is no single right way to heal. But learning how to advocate for your own comfort and supporting your body from the inside out can truly change how to experience your recovery days between treatment. Well, the floor is officially yours on the Ask Me Anything portion right after this, because whether you want to dive deeper into the science of PPARs, ask about managing specific chemo side effects, or just need a bit of guidance for an upcoming cycle, we are here for you. The intention of today's webinar is to make sure we answer more questions coming from all of you for us to be able to empower you even more in your journeys. So without further ado, let's dive right in. Leading tonight's AMA are highly respected experts. First off, it's an honor to present our esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomat of both the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine. He currently serves as an integrative oncology practitioner at several renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, Meta Medica, and Simply Healed Medical Group. Where he offers integrative therapies that complement conventional treatment and provides patient-centered care to those who have chosen to pursue their own path through cancer. He will be joined by a Singapore-based PPARS expert. As a visionary CEO behind Simply Nature International, he combines his entrepreneurial success with years of international speaking experience to share deep insights on how health serves as a foundation of true success. Let's all welcome Mr. Shyan Lim. Good evening, Sir Shyan, and good evening, Doc Jansen.
Good evening, Sheila.
Good evening. Hello.
Hello.
It's so good to have you both tonight. we miss having the two of you. Okay. All right. Shall we go to the first question for tonight?
Yeah, please.
All right. So the question is coming from Ms. Leslie. Question is, can PPARS cause constipation? Case is colon cancer. The patient is already taking vials and tablets for 2 days, but the episodes of bowel movement was lessened and and it became harder. Should they continue, or should the patient continue with PPARS?
Oh, definitely the patient should continue with PPARS. So from TCM kind of perspective, I mean, I'll leave Dr. Johnson for the conventional medicines physiology. But from a TCM perspective, PPAR is also high energy. So you should always take something like PPAR with a lot of water, right? So you drink a lot of water when you take PPARs. Yeah. So that's from my experience and from my understanding. So constipation, yeah, I'll ask Dr. Johnson also. Does it cause constipation? But I do know that when a patient takes PPARs, they should drink more water to avoid incidences of like constipation. Yeah. Doc?
Yeah. It should not cause
Yeah.
constipation. Actually, if you drink PPARS, especially the liquid, it can actually soften the stool even, because if you look at the ingredients, basically what you have with the PPARS liquid are fatty acids. They're basically omega-3 fatty acids, no? So essentially it should soften the stool, just what usually that's other patients experience. So this is an
Yeah.
unusual case of constipation. So with the patient being constipated, that's a different issue that we have to look into. Okay, so but the product in and of itself will not cause constipation.
Yeah, in fact, Doc, some people actually take PPAR tablets to become more regular.
Yeah.
Right.
Yeah.
Yep.
Yes.
But again, from a TCM perspective, definitely when you take any product which has higher energy levels, you should drink more water. So that would be one advice I would give. Yeah.
Thank you. Thank you, Sir Shyan. Thank you, Dr. Jansen. As a start off, I guess, may I suggest this patient, if you wish to go for a consult, or for those of you who wish to have a consult, you can definitely type how to consult. Our caring HCS, Ms. Beth and Ms. Irish, will definitely get in touch with you. All right. For our next question coming from Ms. Lisa Angeles, question is, can PPARS help patient with acute liver injury?
Acute liver injury. If you say acute liver injury, then that can be because of acute hepatitis. It can also be drug-induced. It can be, if it's subacute, then it can be because of an autoimmune issue. So all of which would have inflammation involved. So yes, PPARS would actually help because of the anti-inflammatory or because of the antioxidant contents that it has. But you cannot rely on it as treatment. Okay, you have to find out what caused the liver injury, then you treat that. Okay.
Yep. Exactly same answer as Dr. Jansen. PPARS will help the body recover, help the body manage, but there is a specific reason for your acute liver injury. You have to address that specifically. Yeah.
Thank you. Thank you, Dr. Johnson. Thank you, Sir Sean. Now, the next question coming from Miss Glory Valdovino. Question is, I was diagnosed of gastric erosion. My gallbladder was already removed, and what I felt before when I have my gallbladder is still the same. What can you recommend me?
Okay, you have to treat the erosive gastritis because you don't have the gallbladder anymore. So that's ruled out of the causes the stomach discomfort already. So you have to treat the erosive gastritis. So to treat the erosive gastritis, you have to be on antacids. You have to help the gastric lining recover. So you usually use rebamipide for that to help it heal. Okay, so if the cause is H. pylori infection, then you have to take antibiotics to kill the H. pylori infection. Now, if it is not, if it is stress ulcer, that's a more difficult thing to treat. So you basically have to be off stress, whatever kind of stress. Okay. Another one would be medication induced. So medications, you have to do a review of your medications if something is causing the erosion of your gastric lining. So these things, no. But for simple lifestyle changes, especially for the diet, always avoid foods which are highly acidic. So how do you know if food is acidic? So you basically taste it. If it tastes sour, that's acidic. Okay.
Mm.
So obviously the other ones like soda, coffee, your spicy foods, these has to come off your diet. Okay. So that's how we approach this. Vices like smoking or alcoholic beverage drinking, you have to remove those as well. Okay.
Sir Sean, would you like to add anything?
I noticed the first series of questions tonight has got to deal with a wide range of symptoms. So and the viewers are seeking a natural alternative doc. Obviously, it's so I would share that and they're hoping that PPARS is one of the possible treatment cures, right? So I can share from a practical point of view is this, right? Uh, there are cases where after you see a medical doctor, right? And the doctor, after doing many diagnoses, cannot find out what's wrong with you. All right. So there are many cases of patients undergoing symptoms like that, where it is hard to identify what's actually wrong with you, but yet you are not feeling well. So at this point, conventional medicine will have is in a bit of a fix because in conventional medicine, we need to identify the cause or the illness and diagnose it correctly. Because if you diagnose it wrongly, and that's what happens, why doctors are so careful, is that if you diagnose it wrongly, you will prescribe the wrong drugs, right? So when you can't diagnose it, then you don't know what drugs to prescribe. After prescribing the general ones, for symptoms around the area, but yet if it's not doing anything. So at this point, different approaches to medicine, like lifestyle medicine, like orthomolecular, where they just boost your body's nutrition to maximum and let your body heal itself, becomes one of the solutions a patient can look for after they've already tried all the diagnostics and the doctors can't tell them what is actually wrong with them, even though they know they're not feeling well. So in cases like that, then I would say the liquid PPARS becomes very, very useful, right? Because it just stimulates and activates the body's four major pathways, and through that, hope that the body helps the body to heal itself. For those with chronic illnesses that have the same challenges, like when you cannot really identify what's wrong, but it's not very acute, not very serious, then an approach of lifestyle change becomes a very powerful approach to trying to treat something that conventional medicine cannot that properly diagnose. And that's also in line with acupuncture, TCM, where they try to nourish the body or regulate the body to back to normal. So of course, for acupuncture, they talk about qi and blood, which is very different from conventional physiology. But the whole concept is the same. It's trying to nourish you back to normal and let the body heal itself. So for those chronic issues where you can't really identify what's the issue, but it's not so serious, something like cancer, or the pain is not extreme, then I would definitely recommend tablets because it's very affordable and you can take it long term, and it slowly helps you put your body back into the balance. And same as the Western's approach of orthomolecular medicine, the Chinese approach of TCM, where you're just trying to regulate your body back to normal and let it heal itself. And the reason for this is because conventional medicine can't seem to diagnose the actual issue, right? And because they can't diagnose the actual issue, they might be more limited in the ability to treat with any specific drugs, because you need to know the problem before you can prescribe the actual drugs. Yeah. So I'm just trying to address the first few questions. I'm guessing why you are asking those questions, and I'm giving you the possible mindset that you can take. So lifestyle changes, and nourishing the body and bringing it back to balance. Of course, the first part, as what Dr. Jansen says, if you can correctly diagnose it medically, then use the drugs to treat it specifically, and then all these natural approaches to support the entire healing process.
Yes, Sir Shyan. That is why indeed we always encourage our patients to always coordinate with doctors, even our people partner doctors, to guide them well. Most especially when they diet. It's actually aligned now to what we are celebrating this month, which is Nutrition Month for this July. Okay, all right. For our next question coming from Ms. Cynthia Rojo, question is, I have diabetes, sometimes high uric acid, osteoporosis, and lumbar osteoarthritis, poor sleep and poor memory. My endoscopy revealed intestinal polyps and gastric warts. What can you recommend?
Doc, for a case like this, it sounds like a development, right? Starting from diabetes, everything else starts to compound, right? Yeah.
Yeah. Usually for this kind of cases, no, usually very complex. You start with the gut.
Okay.
Do a detox. Try to clean
Okay.
what you're putting in, and your basically your gut composition, especially the gut microbiota. So if you notice, patient is diabetic, has intestinal, she has also intestinal polyps. She has all these arthritis. Okay, so inflammation is definitely through the roof.
Yes.
So you fix the gut
Cascading.
first. How do you fix the gut? You eat clean, but sometimes it will take a while before the gut adjusts. So you need something like colonics to remove all the, basically to have a gut cleanse, okay? Have a gut reset. So when you do colonics, it's basically enema to remove all the bad things that's in. Okay? So once everything is out, then you change your diet. So typically the diet that would be kind of a balance between all of the good diets out there would be a Mediterranean diet. Okay, I won't say plant-based, but depending on how well you can implement change, then I think the Mediterranean diet would be a good place to start. Okay, but of course, the more plants that you consume, the better, because then the fiber would be able to influence the composition of the gut microbiota and push it towards a healthier population. So once you fix your gut, eventually you will notice your metabolism getting better. Okay? Your mood, your sleep would all soon to follow. Now, the diabetes itself, then you have to investigate why you are diabetic in the first place, because it can come from a lot of things. No? So number one, you can have fatty liver. Number two, you can have thin muscles or muscle atrophy. Number three, it can be because of stress. Number four, it can be because of there you have it. You have poor sleep quality. Number five, how's the health of your pancreas how well is your pancreas secreting insulin? So those things you have to investigate. Okay? Now the problem here is the lumbar osteoarthritis. The lumbar osteoarthritis, it is a degenerative disease, and once you get osteoarthritis of a joint, it's very difficult to reverse. Okay, so especially it's in the lumbar part. You cannot inject that area with something. Okay, so what you have to do there is in the hopes of getting it repaired, is you remove the blockages of your artery, and so that you can provide a better blood flow to the area. Okay, so just for you to know, the lumbar spine or the vertebrae is an area of the body, or bones in general are very poorly perfused. It's a poorly perfused area. So once
Doc, what do you mean by profused?
Thank
the
you.
blood supply is poor.
Okay, poor blood supply. Okay.
Yeah. So the blood supply is not that good. Okay. So if the blood supply is not that good, then the nutrients or the capacity of that part of the body to repair itself would be not that good as well, because where else can it get the nutrition it needs? Okay, since it has poor blood supply in the first place. Now, if you block the small arteries that's left in that area, that's going to get worse. And it is something that the patient would definitely have, because the patient is diabetic. Okay, the quality of the blood vessels is not good, right? So how then do you fix that? Okay, I'll give you suggestions, no, from the more high end and things that you can implement that are quite manageable. So stem cells then will come in. Stem cell therapy, because stem cells can go to areas of your body and repair them. Okay, so you would be a good candidate for stem cell therapy, actually, especially if you have that lumbar osteoarthritis. Now, stem cell therapy is a very expensive therapy. Okay, it costs millions. All right, so if you're someone who's not too keen on going for that treatment, then simplest things that you can implement would be the food that you're eating. Okay, getting your blood sugar controlled. Okay, so those things are the ones that's needed to be done. Now, the uric acid, the reason why you have high uric acid is because of the diabetes. So if you control the blood sugar, the uric acid will naturally come down. Okay, so that's the approach. That would be, I think that would be good. Now, so you have a range now here of therapies, no, regenerative therapies that you can explore. So the most high end would be stem cell therapy. Stem cell therapy can reverse that. Okay. Number two would be somewhere in between, would be a little bit cheaper than stem cells, would be exosomes. Exosomes are capsules, no? These are capsules that stem cells secrete to repair, to influence regeneration of the environment around it. Okay, so that's what exosomes are. So what the researchers did was
Regeneration.
they cultured stem cells, then they harvested the exosomes that these stem cells are producing in the laboratory. And the exosomes that the stem cells produce, they packaged it into packages that can be mass-produced and easily administered in the clinic. So exosomes is somewhere in between, but it is still expensive, but not as expensive as the stem cells. Okay, so going down even further would be, of course, the lifestyle already, and getting your issues controlled. Okay.
So,
Mr. Shyan?
thank you, Doc Jansen. As Doc Jansen explains how the many issues actually snowball and are interrelated, how you have to get the gut fixed first, then next you got to manage the diabetes. As he explains, I hope everybody now realizes why Simply Nature PPARS is sometimes gives such miraculous effects. Okay, because to a patient who takes Simply Nature PPARS, it seems like wow, the Simply Nature PPAR, especially the extracts, are doing something miraculous. Well, Doc Jansen's explanation actually gives us an idea why it has such a seemingly miraculous effect. Because Simply Nature PPARS actually works on all these factors at the same time, right? So your blood sugar is being regulated, whether it be a muscle issue or a kidney issue or another reason why you're developing diabetes. So unlike one drug, right, or a single approach like colonics, which will clear your colon very completely, all right, clean it up and quickly help push it to a level of cleanliness, right, and then solve one aspect of the issue, right? So Simply Nature PPARS actually attacks for a patient like you all across the board, all the root causes that are actually interlinked, one leading to another. So because of that, there is a synergistical effect on you, the patient. All right. So for example, if you are having a high fever, right? High fever, how would you feel if your temperature came down? You'll feel better. But if you still have a splitting headache, you still have a splitting headache, right? So what if the symptoms actually go down in a way where your headache actually subsides, your temperature goes down, but not to normal, but it goes down, you feel stronger. So it's a little bit of everything, but the total effect is you feel you're recovering, you're moving forward. Okay. So one of the advantages of Simply Nature PPARS is that it actually triggers different pathways and attacks your root causes, multiple root causes from many different how shall we say directions, which is why it's such a powerful foundational supplement or part of your protocol. So again, one of the top orthomolecular doctors, he uses Simply Nature PPARS as a catalyst, right? So he prescribes, like Dr. Jansen, he prescribes specific vitamins and minerals. Again, this is orthomolecular, so they don't use drugs, all right? They use nutritional supplements. So he prescribes different supplements for different aspects of the patient's condition. But then he uses Simply Nature PPAR liquid as the one, like a catalyst, the one that makes everything go to the next level. So pump it all up. And then the patient has that miraculous recovery. So some of the patients that he shares with me, the patient cases, it's really quite amazing. It's like cases where the doctors don't know what to do with, and a single supplementation doesn't seem to get the job done, helps the patient, but doesn't really cure, right? Doesn't treat it to the point. It's more like palliative than actual treatment. But when he adds Simply Nature PPARS to it, everything just comes together. So it's like what Dr. Jansen says, there are specific protocols working on different aspects of your illness, and chronologically, which one do you attack first and settle first before the other. So one thing wonderful about Simply Nature PPARS is it allows your body to actually work on everything synergistically from different angles. And why do your pain go down? Because your inflammation went down, your blood sugar at the same time improved, and your diabetes comes under control. A lowering of the inflammation and improve of blood circulation, as Doc mentioned about your lumbar issue, right? Creates what is miraculous, because alone it's hard to settle the issue of your lumbar, right? So this is when everything comes together. So again, sometimes when we also hear about how a simple lifestyle change can cure, for example, right, Doc, the lifestyle medicines testimonies and case studies where they show people with chronic high blood hypertension and high blood cholesterol and high blood sugar that medication cannot seem to manage. Yet when they change their lifestyle in 6 months, everything improves. Even their skin improves. Everything improves, right? So this is where we're actually trying to have an effect synergistically all together. Whereas drugs, we aim for one at a time. So again, that's to address the series of questions that we started tonight with. Yeah. So we're on the same track. Yeah, along the same track. Everybody's looking for the one magic pill, lung. But there isn't that. But you can understand that because of some issues, like it will lead to other issues in the body. And then what you really wanted to be able to is if you can tackle multiple as well as focus protocols as well. Yeah.
Thank you. I'm glad that you've mentioned that, sir, and of course with your powerful explanation, Doc Jansen, because it's actually a common question, and a lot of people really would like to do away with their maintenance medication. And I believe if a person would really be religious enough to really follow and be obedient to their maintenance medication, would we say that it wouldn't cause this much of health concern? Would that be the case?
If you always take your maintenance meds, Doc, if you are good with your maintenance meds, from an integrative doctor point of view,
Yeah.
is that a long-term solution, or will I mean, in your ethos, will lifestyle change still be the best option?
It should work hand in hand. It should not be one or the
Mm.
other.
Okay,
But
so it's a false dichotomy, yeah.
yes, yes. So well, if you are somebody who's not too keen on changing your lifestyle, I mean you're sedentary, you just
Yeah,
cannot eat good food, then
and drugs is
I
the
mean you
issue.
have to take your medication. With your medications, if you take them on time, if you're good in adhering to this, then you'd still go a long way.
Yeah.
Right? So you'd still be able to live a long life, but of course, expect your medications to increase in number over time. So that's the
All right.
thing. Okay, but of course, in terms of risk, these medications would prevent plenty of the diseases that we have nowadays. But
Mm,
yeah, there's always a trade-off here, right? So the trade-off
mm.
is expect pills to increase over time. So lifestyle should be there so that one, you would be able to reverse whatever you have if you do it intensively enough and uh a- a significant for enough period of time. Um if not, then at least you'd be able to minimize the number of pills you are taking, right? So that's the whole point of prevention and getting all these complicated diseases in the first place. So it works hand in hand. Of course, if you can do both hand in hand, that would be better, right?
Mm, mm.
Perfect. Thank you. Thank you, Dr. Jansen. Thank you, Sir Sean. For our next question coming from this Mr. Dion Baste. Question is, what is the health benefits of PPARS and how much would it cost to cure and would work for a stroke, constipated, high blood, diabetes, and prostate enlargement? Now, this one has a prostate enlargement.
Wow.
Multiple again.
Okay. I'll tackle this, and it's there are different options that you have, all right? The option which is the one that will give you the, I would say, the best results will be if you actually take liquid every day for a period as long as 6 months. Okay. I actually have a patient who does this. Okay. So how much would it cost? It would actually cost quite a lot. All right. It would actually cost like more than 120,000 pesos a month. All right. Every month. Right. Are there patients who do that? Yes, they actually are patients who do that. The patient that has done this the longest is there was a particular patient who's also a personal friend's sister, right? Takes 2 vials of liquid extracts every day. She took it for 2 years nonstop. So you can just imagine how much the person spent. But this person was able to live a strong, healthy life when her original prognosis, she is a third, not set, okay, second. So third time cancer, second time recurrence breast cancer. So she went to the US. The US doctor said, we cannot treat you anymore. You are terminal. So this one maybe Doc can shed some light, but it was interesting. What she explained to me was that in the US, the doctor said she has exhausted all protocols for them. So they really have no more treatment for her, but they actually recommended her to Singapore. I guess different countries' medical guidelines have slightly different parameters. So I guess in Singapore they could push it a bit more. Because then she went to Singapore. She had additional sessions of chemotherapy, right? So after about 2 months of chemotherapy, the doctors really told her there's nothing that we've tried everything. There's really nothing more we can do for you. So they gave her something like less than 3 months of life left, right? And they were being rather optimistic by giving her as much as 3 months. So you have to remember, in the US, they said there's nothing they can do. It's terminal already. So they gave her just like something like 6 months. And then when it came to Singapore, did some treatment and still nothing they can do. Then on her way out, she actually saw PPARS liquid at Singapore Cancer Center's pharmacy, if I'm not wrong. And she came back to Philippines, checked with her sister, checked with me. It turns out it's the same as our product, Simply Nature PPAR liquids. So then she went on it for 2 years. right? So she was able to extend 2 years beyond what the doctor said. And yeah, that is the extreme case, most extreme case I've seen. Now, for your case, the manageable one in terms of finances would be to always take the Simply Nature PPAR tablets and to be taking it at a very higher level, so at least 10 micro tablets 3 times a day, right? So that will just, over a period of time, will just help your body rehabilitate, okay? So our research has proven, very interestingly, if you don't stop taking PPARs, what happens is that there is actually a cumulative effect. So if you take 10 micro tablets today, 1 year after you first taken it, the effect it has on your body is better than the first time you took it. So if there isn't a break, there is actually a cumulative effect. The other research that we did based on dosaging is the higher the dosage, the stronger the effect. Okay, but there's also the cumulative effect. So there are two approaches you can do to it. So again, you can start with something stronger, like soft gel capsules or even extract powder or even extract liquid, and then taper it down. But the key thing is with so many chronic issues, it's going to take time, going to manage your finances to be able to last all the way. So if you're on the tablets, then you are budgeting something around, like, if I'm not wrong, Sheila, you have to calculate for me. So it's probably around 6,000 to 10,000 pesos every month. That is about $200, right? So I think that is relatively affordable. Will it actually cure you straight away? No, it will just put you on the right direction and journey. Along the way, you can try other modalities that Dr. Jansen might suggest, but this will become like the foundation thing that you constantly do that will put you in the right direction for your body to heal, right? Yeah, and then you can choose some specific protocols for specific aspects of your illness and target that one. Just for example, that season you want to target that one first, but you continue taking the tablets as your base, right? Or you can start with the liquid and see how it helps you, and then manage your finances accordingly. So you can speak to our CS also. Yeah, Doc. Sheila, you better read the whole thing again so that Doc refresh his memory.
One
Yeah,
more
'cause
time.
it's quite a long list of things, right? Yeah.
Thank you. All right, no problem. Once again, the question is, what is the best benefit or what health benefits of PPARs, and how much would it work for? Would it need to work for a stroke patient, constipated, high blood, diabetic, and prostate enlargement patient?
Oh yeah, actually for the metabolic syndromes, it will work definitely on the high blood cholesterol part. Yeah, correct.
Okay,
Okay, Doc.
I won't answer how much.
Yeah.
You actually need, I have to, we have to do a consultation
Yes.
for us to pinpoint the problems.
Mm.
So just enumerating the diseases of the patient will not give us um, a good insight on what the problems are, because these are symptoms. Okay, the stroke is a
True.
complication, and
True.
of course, you asking this, I think I would assume that the stroke would have happened way
Sometime
back.
already.
Okay,
Yeah.
it would have happened way back. So these are symptoms of an underlying issue. So what I can do here is give you a kind of a map or step-by-step process on how the treatments would look like. Okay, so first is to get an assessment of the metabolic issues of the patient. Okay, that's number one. Number two, we have to do detox immediately. So the detox would involve multiple organs. No, so number one would be your gut. Number two would be your blood. So we have to do chelation therapy as well for this one, because you suffered a stroke. I would assume that it was because of a blockage, no. And if it happened, if it is ischemic stroke, not hemorrhagic stroke, if it is ischemic stroke, then other blood vessels in your body would be blocked as well. So we have to clean that away through chelation therapy. Number three would be plaquex. Plaquex is a treatment wherein it goes hand in hand with chelation in that it helps dissolve the plaques inside the arteries. Okay, so this is to restore the blood flow. Another area that we can look into would be to detox the liver, and this is where Simply Nature will come in, no, and other supplements, of course. But we have to assess the liver function, of course, no. If your liver don't have any issues, then well and good. So then of course you have to still be on your medications. It cannot go away, at least for the next foreseeable future. So you slowly wean away from your medications as your blood parameters improve. So that's a very general idea on how we can approach things. So first is to detox the patient. And also, Simply Nature PPARS is also very good in detoxing because it's made from microalgae. It basically binds the heavy metals and pulls them away from your
Yep.
body.
Yep.
Okay. So that's a general approach. Okay. So I won't answer the how much it costs because I mean the answer is basically I don't know because I don't know what to do with you without any consultation. So this is just me addressing giving you a very general idea or a broad picture on how things can go. But of course, the therapies, the treatments that I have mentioned have limitations. Okay? Example, you cannot do chelation therapy if the kidney is already broken. Okay? If your creatinine is 2 and up, then you cannot do chelation.
Doc,
Because yeah, right. Yeah.
so I have a question. Chelation, I've noticed at different integrative clinics there are different types of protocol. Chelation is best done intravenously or through capsules?
Intravenous. You cannot do it through oral or
How come
capsules.
so I have been to some integrative clinics and they actually give capsules for chelation. So that one is not real chelation?
No.
Okay, so it is intravenous is the effective one. It's just like people always tell me, sometimes when I meet patients, they're very cute. Doc, they'll say, I'm doing stem cell treatment. I'm like, oh wow. And then I said, how much? They say 1,500 pesos per month. Then I said, that is not stem cell treatment. It's not possible. Then they tell me it's a plant stem cell, and then they show me a powder and So just to get it clear, so chelation, effective chelation can only be done intravenously.
Yes,
IV. Okay, it's
yeah.
IV. That's
So
what I first understood also. But then I went to some clinic and they had this. Yeah. And next question, colonics. That's also like intravenous in the sense that it has to be a service, right? You actually have to have a physical service. You can't take capsules and call
no,
it
you cannot. You
colonics.
cannot. Yeah, you
Right.
cannot. So the colonics is they put a tube in your ass.
Yeah.
Then they push water or coffee.
And then
Then
they clean it, right?
yeah,
Yeah.
it basically will soften the stool for you to
Yeah.
defecate them out.
Because Doc, there's also this thing called people. As Doc share about detoxing, Doc, there are integrative doctors or naturopathic doctors that sell products that do colon cleansing, and they say that's like colonics. It cleans your colon. But I've actually in Singapore there have been cases where colon cleansing supplements actually killed someone, because it's very strong. It can like destroy your colon, right? So colonics is not taking some colon cleansing pill.
No, actually, you can actually do colon cleansing with just
Okay.
oral methods. So
Okay.
how gastroenterologists prepare patients for
Okay.
colonoscopy is through colon cleanse as well, but they do it orally. So you
All
can
right.
do it oral.
Okay.
But from the story that you gave, that someone
Yeah.
died from the colon cleanse, is that that person have complications already that the colon cleanse should not be done on the person. Okay,
Okay.
so the initial state of the patient
Mm.
is already so bad that
Mm.
when they introduce the colon cleanse, it worsened the condition of the patient. Okay,
So
so
Doc, is this the same for colonics as well? Are there cases where patients should be very careful about going for colon?
yes, so we don't do colonics to all patients blanketly, no. One contraindication, or I usually don't advise patients who have heart problems to do colonics.
I was thinking about that. Yeah. Yeah. So
Yeah, of course, if you already did colon surgery, then you should not be doing colonics in the first place, at least within 6 months of the surgery. Okay, so that those are some of the uh contraindications. So it's also nuanced.
yeah, so it's really the experience. I mean, I would feel safer if the person doing all these natural therapies are well versed in medicine as well, especially in physiology, right? Doc, there is something that's happening in Singapore. I think when I spoke to you about this topic maybe 2 years ago, we mentioned so the first hyperbaric chambers have been officially accepted in Singapore already. So Singapore is moved. So to all those of you who have on our program, and I know it's many of you, it's like 80% of you, it seems like the world is moving towards natural therapy, right? So in Singapore, hyperbaric chambers used to be illegal, everybody. It used to be illegal.
Used
It
to be
means
illegal.
that yes, it's illegal. That's why Dr. Homer's disciple actually a Singaporean who actually learned all about from Dr. Homer about all the wellness integrative approaches. He actually opened his wellness clinic in Malaysia, where the laws are a bit more flexible, right? Because it's actually illegal in Singapore to do like hyperbaric chamber treatments, right? But now it is legal. So of course, to all our patients over here, you are saying, if it's legal now, why wasn't it legal 10 years ago? It's the same thing. It's the same thing. So I can only say that I think the attitude and the knowledge of the medical profession is changing. So in fact, in Singapore, it's actually starting from the top, doc, in the sense that it's starting from the most expensive treatments are going to be the wellness treatments. It's not the same as in Philippines, di ba? In Philippines, you go for natural therapy because oh my God, the cancer chemotherapy is so expensive, and people look for natural therapies, right? In Singapore is the other way around, and it's actually being a lot of this is opening up because of longevity clinics, right? A lot of clinics that are longevity is not your traditional medicine, right? So there are more things like hyperbaric chambers, and from there it's also expanding into supporting cancer patients. All these alternative treatments. So I'm quite sure colonics, all this will be part of the entire wellness scene in Singapore. So yep, that's actually going to come into Singapore. But it's coming in on the really high end. It's not it's the reverse way. But I think it's a validation that what we talk about on this program, what Dr. Jansen is sharing, all right, from his ozone therapy to everything. Now that used to be fringe medicine, doc. Yeah. But now it's coming in, and it's coming in strong and with very credible brands and very heavy capital investment, which means it's not cheap. So yeah. So to everybody, going natural is becoming more and more real. But again, please, if you have things like tuberculosis, it can be solved with antibiotic, okay? So no need to go natural sometimes when the solution is so clear. Yeah.
Thank you. I do hope that our viewers really appreciate the honesty and the broadness of how you are answering the questions, because we are Simply Nature. We have the PPARS as the carrying product of ours, but we discuss colonics, we discuss hyperbaric. I just want to say that since you've mentioned hyperbaric is really inside the hospitals now. I've seen one in St. Luke's
Oh,
Global. Yes. And
wow. Okay.
from what I've
Hard
heard,
shell, right? It's hard shell. I assume
it
St.
is.
Luke's will do hard shell. Yeah.
It is. It is. And I think some hospitals are also accepting what is acupuncture as well. So
Oh, yes,
thank you.
yes.
And Doc Jansen is, I would say, is in the with this so
Doc
much.
Jansen traced his historical roots for a short while. He took up TCM for a short while. He was being Chinese for a short while.
I mean, I just wanted to say that he has a lot to offer in terms of other modalities that you could
Yeah.
incorporate with your with your treatments apart from PPARS as well. So I just want to say that for the two of the two people who ask us with multiple health concerns, okay, and for others who wish to have a consultation with Dr. Jansen, just simply type in how to consult. Our caring Miss Beth and Miss Irish will definitely get in touch. They are the ones who will be aligning your availability with Doc Jansen's availability as well. Okay, all right. Very quickly, our next question, actually coming from two persons, Miss Irene and Miss Ningning, because they kind of have two same questions. Is PPARS, or what can you recommend for psoriasis and for eczema for a baby?
Oh, baby. Oh, wow. I think for baby, that means infant,
Yes.
I would just really recommend the tablets. Crush it, mix it with their milk, and that should be fine. All right. I wouldn't even go for any extracts for the babies, right? And it's gonna be good for the baby because the tablets is a superfood. It's a super green food, right? So it's gonna be very good for the baby, for his growth, for his or her growth, for her development as well, and it will help with the eczema and psoriasis. I would also recommend 80 Pro for topical applications because it's a baby. When you do have a breakout, right? If the baby itches, then it will scratch and it'll make the thing worse, and it might even scratch the face. And then normally for babies, you don't want to put like things. You don't want to put ointments that are not safe. For babies. So any steroids we try to avoid, right? So 80 Pro is a completely natural probiotic, right? So it's so safe you can actually lick it. So you're not afraid that your baby actually, for example, if the hand has this and then the baby put the hand in the mouth, you won't say, "Oh no, I just put the ointment on the hand." You won't have such worries. So this is actually the best thing. And again, if the breakout, baby skin is very thin and more thin and more sensitive than adult skin. So again, the use of strong ointments for eczema and psoriasis for babies, dermatologists will worry. Why? Because the thinner skin means that the medicine can go into the bloodstream, which they try to avoid. They just want to keep it on the skin. Right. So again, a probiotic is the ideal way to deal with the breakout. So I think you can check with Sheila. There is a special promo now, I think, with our 80 Pro. So it's a great combination, tablets and 80 Pro for babies, right? For adults, we will go all the way to soft gel capsules, right? Yeah.
That's true. Right. Doc Jansen, would you like to add anything for eczema and psoriasis?
Okay, for psoriasis, you would want to look at the vitamin D levels. Usually for autoimmune disease patients, the vitamin D is really, really low, and you would want to correct that. How do you correct it? It's very simple. You take vitamin D supplements. So it's just it's a question of how much you take and how you assess the patient. Okay. For skincare, for psoriasis, you have to ask your dermatologist or your aesthetic derma. Okay, I'm not the expert to talk about that. But autoimmune disease per se, vitamin D is something that you have to look into. And then how do you balance the dose? You have to look into PTH and the ionized calcium. And remember, the toxicities of vitamin D is not in the dose of the vitamin D, it's in the ionized calcium levels. Okay? So that's what you monitor, not the dose of the vitamin D per se. Okay? So when you do an assessment, don't be afraid of the vitamin D levels as well. If it's too high, that's not how you assess. Okay, you have to look at the ionized calcium levels. So that's for psoriasis and autoimmune disease patients in general. Of course, antioxidants is always part of the protocol. So there are a lot of antioxidants that can use. So Simply Nature PPARS is one, vitamin C, etc. Okay. For a baby who has atopic dermatitis, you look into probiotics and then you remove toxins in the environment. So you have to change the detergent, make sure there are no fragrances. The personal care items that you use, make sure it has no fragrances. Okay, and do not be too clean in the household.
Oh,
Do not be too clean. Okay.
so we
What
gotta
do I
let
mean
the
by
baby develop immune response.
yes, you'll have to let the baby develop the immune response properly. All right. So you do that by way of probiotics as well, in a very controlled environment. So you have to understand that atopic dermatitis is a disease of the immune system overacting.
Mm.
Okay. So the immune system is overacting and it's manifesting to the skin, which is atopic dermatitis. Okay. Foods, of course, you have to avoid, try to avoid eggs and chicken. These two. Milk, try to avoid dairy as much as you can. But if it's an infant, then breast milk is always the best. Formula milk might not be too good, but you have to ask your pediatrician about this. Okay, but usually milk or especially dairy, we don't advise patients who have bad allergies or bad atopy to consume dairy because milk can enhance the manifestation of allergies,
Sensitivity.
right? But definitely you have to look into the gut. So probiotics is definitely in, right? So that's how you approach things. At least something that you can implement right now. All right.
Okay. I
Roshan, you're sharing
wanted,
something?
yeah, I wanted to show everybody, right? So this is actually this is a pilot study, right? So this was done with the Center of Disease Control in Taiwan, all right? So I would just show you guys the deck. So this is the science behind it, and these are the controls and the results. So they followed patients, but since we are talking about AD, and for atopic dermatitis, psoriasis or eczema, okay, a picture is worth 1,000 words, lah. Okay, so this is adults who have severe psoriasis, right? They have been on steroid protocols, right? So very strong steroid protocols. And this result that you see is mono protocol, which means they stop taking their steroids. They're not applying anything else. They are surprisingly not even applying like anything more than moisturizers. So no treatment creams. And this is psoriasis patients after 3 months, right? And here's the most encouraging fact. They were only taking the Simply Nature PPAR tablets, just the tablets, right? The actual dosage for this is 60 tablets a day. Okay, this is the dosage. But of course, you can see how serious they are, right? You can see before, after. So again, for AD, I think many AD patients I speak to sound very hopeless. It's like, well, we've tried many things, works for a while, then after that doesn't work anymore. I mean, and they seem very exhausted, like they don't, it's like you got your heart broken so many times you don't want to fall in love again. So for AD patient, I do notice those who are this serious, they reach a point where I guess they don't get their hopes up, right? Because it's something very obvious for the rest of the world to see as well, right? You can't hide your AD, so especially, can you imagine this one, right? I mean, this is very obvious. If you walk down the street like that, people will be very wary of you, right? They will actually walk away from you. So we can imagine the emotional strain on an AD patient. But anyway, here it is 3 months. It took 3 months for the results before and after. So you can see this November, December, January, and then February. Okay, sorry, 4 months, right? And it's 60 micro tablets a day. This is the result, all right? So for the question, I hope the person who asked, I hope this is very encouraging, because if it can have good results for this case, then I think any other case is, you can be very hopeful. Okay, the next thing I want to show you is we can have, so the PPARS works from the inside out, right? As Dr. Jansen says, it's an immune deficiency. So the problem is from the inside out. So we are able to solve the issue from your immune response from the inside out. But when you are having an AD outbreak, you're going to feel itchy. So your baby or your infant is going to feel itchy. So here is what happens when, okay, here you see on top, right? The purple color is Staphylococcus. This is what happens when your baby's skin becomes red, all right? And it's very itchy. So the entire surface of the skin is basically the purple color strain of bacteria, and it's causing all that inflammation. leading to the inflammation. So the probiotic strategy is to introduce another bacteria that controls this strain, this staphylococcus, so that its count drops, right? You will notice here you will see a control baseline post-flare. Post-flare, that means after the redness subside, right? Be it you use antibiotic cream or whatever, when you check the skin, you will notice that the staphylococcus count has dropped, right? So that's why the redness also goes down, the itchiness also goes down. So you can achieve this by putting antibiotic cream that kills staphylococcus, or you can use a probiotic approach. That means you use something to control or to fight or crowd out. It's like you introduce a tiger into the jungle so that, you know, the hyenas run away. That kind of simple concept. Okay. So again, here a picture is worth 1,000 words, right? So this is a patient, no medical history. So a new case of AD, you know, with children, that's very common. So before, after, this is a baby, not baby, a young, it's a toddler, has AD for 4 years already. And then it took 2 days to see the improvement. Okay, this one is not baby oriented. You can see, yeah, here, right, AD for 4 years, AD for 3 years. You can see the improvement of the skin. 4 days, 4 days, right? Very, very good results, right? And then here, this is the first case. The inventor of the product, actually, she is a probiotic expert for gut. She creates bacteria strains that she sells to Korean companies and Japanese companies, and they use it in their probiotic products. Okay, so she's a specialist in creating bacteria strains. She had a friend that come to her, introduced to her an infant with the skin that you see on the left. That is what got her to decide to look into probiotic for the skin. So it was just like an experiment. This is the case 001. This is the one that made Professor Xie actually say, you know, she was so moved by it that she said, maybe I go and try and do something to help this kid. So she formulated her first version of her AD Pro, her probiotic for the skin. And, you know, it took 20 days. So from like $3 to like that. So I'm showing this because you said infant. So I hope it's not so serious. But if you are, I'm sure as a parent, you are very, you're very stressed. You know, your kid is undergoing things like that. So also for diaper rash, very effective, okay, to help the body heal. So that's just AD Pro for you. And that's how eczema and psoriasis from the inside and the outside, we have some solutions. And as Dr. Jansen said, additional supplementation, take a look at the levels of vitamin D in your body and how you can go about it. But for PPARS and AD Pro, there is actually no dosage issue. That means you don't have to worry, there's no overdosing. All right. Yeah, correct. Okay, yeah, that's it.
Thank you. So it's good news. You both have solutions inside and out. So no steroids. And yes, Sir Shyan is correct. Please stay tuned until the end of the program because we will be announcing some promos about this AD Pro as well. Thank you. All right, let's perhaps answer 2 more questions.
Okay, 2 more. One more.
Okay, one question coming from our viewer commented, what is the taste of PPARS powder?
Oh, what's the taste of people powder? Okay. Different people get different tastes, okay? Will the taste change as you eat the powder from one jar to another? The answer is also yes. Because especially for patients, and many of our patients who take PPAR powder are cancer patients. So based on your treatments that you're taking, for example, chemotherapy, radiation therapy, or whatever you're taking, it also affects your taste buds. So sometimes it will end up tasting slightly more metallic But to a person who does not have any illness like me, okay, it tastes like algae lang. It tastes like algae, very vegetable taste lang, okay, with a slight sweetness to it. Okay, with a slight sweetness to it. So that's how it tastes like. Okay, is it terrible tasting? The answer is no. Okay, it tastes like a very strong level of mongo with a slightly more seaweed taste than mongo. Mongo you know the taste of Mongo, right? Mongo Friday. Every Filipino should know the taste of Mongo. Now, but you add a bit of like a seaweed taste to Mongo, a bit stronger seaweed taste to Mongo. So that's about what it tastes like. Okay. But here's my final comment. If you are sick, don't worry about the taste. Okay. Even if it tastes terrible, you should take it so that you get well. All right. You don't take medicine or any treatment because it tastes good. Okay. And the Chinese have a saying, if it's not bitter, the medicine's no good. Okay. So no pain, no gain. All right. But no, it's not bad tasting. Yeah.
Thank you, sir. Dr. Jansen, would you like to add anything? The taste.
The taste is what you described. I mean, yeah. But for me, it tastes like seaweed, but
Yeah,
yeah.
correct. Doc, there was it was a very interesting product called I don't want to do advertising for them, but anyway, yeah, it was a product as a network marketing product. It's called Asia. So it's redox, I think. It's the whole concept is that water, you drink that water, it helps your cells communicate. Okay, it's basic concept. But what's very interesting about that one is the taste test. So actually, if it tastes bitter, you can actually use the taste of the product as an indicator of your classification of your illness. So that one it was very interesting because it was quite accurate for me, right? And the chart that my friend gave me when he introduced this to me, it triggered my lessons in TCM about when you are sick, certain taste, right, is more prominent to you. So what happens when your tongue tastes bitterness more acutely compared to sourness, right? It actually indicates your health. So this question is just to the person who asked. In case you think that why is the product taste changing or any supplements that you're taking or even fruits or whatever, is because your health condition actually affects the taste of what you eat. All right, so just a extra tidbit.
Thank you. Thanks, sir. It's good that you've mentioned this because some of our clients actually says that it's quite salty. Some
say metallic.
Yeah,
some say
it's metallic. But I hope that it would encourage you to know that this is the same recommendation that we give to kids who have cancer conditions, and they are able to tolerate it. So I guess all the more that you can do it. Okay. All right. Well, that would be our last question for tonight.
Okay, yeah, very long day. I still got a long night. I have a lot of things to do.
Well, of course, just before we say goodbye to our viewers, as we wrap up this evening, we'd love to hear your final thoughts on our viewers. As we start off this July, in our Nutrition Month awareness month. Sir, Doc Jansen, would you like to start off?
I'll go first. So,
Okay.
so for the viewers out there, who are watching, if you have anything, especially for cancer, what I had is cancer cases. So, if you're exploring different treatments, then just schedule a consult. Let's explore some options that we can do. Okay. And don't lose hope because there's always something that we can do no matter where you are at the stage of your cancer treatment. Okay, so that's just what I want to share because I have encountered one patient yesterday.
Oh, wow. Okay.
The patient has well, one breast have already been removed, no? The other one now has another tumor has appeared right now with the other breast. So they came to me asking for opinion on what to do with the breast that formed another tumor because she just had one breast removed.
Already.
So this is quite unfortunate to happen for this lady. But since the surgery from the other breast was just fresh, 3 months, just 3 months this month. So they're kind of looking for ways, explore options so that they can delay surgery for the other breast. So this lady actually cried in front of me. Okay?
Oh no,
because
quite difficult
because of fear, because she it seems as they get more information, everything seems to be more confusing after the consultation. So she kind of feels hopeless, and she kind of feels frustrated as well with what happened with her condition, and she's quite apprehensive on going into different treatments because of side effects and all of these things. So what I told her was, this is perfectly understandable and normal if you have this kind of condition, of course, no. And the only thing that the only thing that you can do is, I mean, try not to be fearful, because fear can paralyze you. Even if the right treatment is already in front of you, if you're fearful, then you won't go for that treatment. So it will come to a point where it's already too late because of the fear that you have. Okay, because a lot of, so in cancer care, because there's no perfect or guarantee in cancer care. Okay, because the tumor itself keeps on evolving and it mutates. It also adapts to the treatment that we're trying to give. So that's what makes it difficult to treat. So for patients who have cancer, it's very important for you to be resilient. It's also very important for you to have a positive mindset. So I'm not trying to give false hope here. I'm not trying to invalidate uh your emotions or feelings or what or how you feel, but if you are fearful, then that will paralyze you from going for treatments. And for this kind of disease, we won't know what happens to you unless you go for it. Okay, we can only predict, but predictions can be wrong. All right. So this is something that I have to put out there, because this is very this I have encountering a lot of patients who have this issue of fear. Okay, and it's only you who can overcome this. All right. So that
Doc,
would be my, yeah.
Doc, how old was this patient?
How old? She's like 50s.
Oh, 50s. Oh,
Early.
50-year-old person crying in front of you. That
Yeah, yeah,
out
yeah.
of
Yes.
fear.
Out of
That
fear
must
and
out of
frustration as well.
So, Doc, many of just a question also. So do you also feel that they lost like trust? Is that the one of the source of their fear? Because uh yeah, yeah, I'm just curious because many times for Simply Nature clients, we have more, honestly, to those viewers, right? We really have more patients who want to go natural than the conventional, right? So this is really, and the reason is because many of them actually has gone for the conventional and it didn't work out. But I also want to caution many people. There are many people who tried natural and also didn't work out as well. It's just that we don't hear the stories as often, right? Yeah. So if you ever lose confidence, I think it's find a doctor that you can connect with, lah. I think if this particular patient connected with Dr. Jansen, then that's the beginning, because it takes two-person, the doctor and his patient, to go through this journey, right? If you can't connect with your doctor, I'm sure it's hard to get hopeful about anything. So yeah. So in the end, what happened to the patient, doc?
And she has to stop crying. First
Oh,
thing,
so she stopped crying,
Number
and then
one.
crying. She stopped crying. Okay, but
okay,
this is very real.
yeah,
I
very
just want to
real.
put it out there. This is very real,
Um,
and it's perfectly understandable if you're fearful and frustrated. But it cannot end there. Okay, it cannot end there, and it's only you who can help yourself
mm,
out of this state of fear. Okay, because again, if you're fearful, you won't be able to move. Fear is very paralyzing.
yeah,
Okay, yeah. So that's it. That's it.
be hopeful. Doc's
Yes, be
final words
hopeful.
today, be
Be
hopeful.
hopeful. Yes.
And trust, you can trust Doc because he has seen the worst cases and still it turned out well, right? So he's seen difficult cases turn out well. So that is his hope is not based on nothing, right? Yeah.
The doc will never sugarcoat anything, but would still be try his best to be very hopeful.
Yes, I won't sugarcoat anything, but I'll
Yeah.
try to be as gentle as possible with with my choice of words. Okay. Yeah, but sugarcoat things, because I mean, if you get me as your doctor, my duty to you as my patient is
To
what
tell
is
you the
true
truth.
out there. It should be the truth, right? So yeah.
You,
There you
Thank you,
have
Doc.
it. There you go. There you go.
Okay.
Thank you.
Okay,
Sir
for myself, I think tonight, although our questions tonight are surprisingly not about cancer.
Oh.
Yeah. But it will go back, whatever your illness is, right? I would tie this back to why in a country like Singapore, where we choose, I mean, if you talk to any Singaporeans, they're usually very logical compared to Filipinos, right? So Singaporeans make better engineers than I guess in general a Filipino. But Filipinos do very well in creative industries, right? From creative arts to industries that are very high touch, right? From counselors and so on and so forth. Okay, so for a country like Singapore to now TCM, traditional Chinese medicine, is actually equally accepted. In fact, in a neighborhood, in a barangay, it's quite easy to find more TCM clinics than conventional family clinics. Okay, especially in barangays with more elderly people. Okay, now I think I want to bring this back to the point that even in a country that is very science-based and evidence-based, there is a huge shift that people begin to realize that, as Dr. Jansen's last sharing about his patient, they realize that it is not enough. Okay? I think this is what my last message is. Just by taking drugs and conventional medicine is not enough. It's not saying that it's not effective, it's just it's not enough, it's not complete, right? It's not complete. So there is the importance of strengthening the body as you treat the illness. This is growing in awareness among the doctors. So you can see why even things like hyperbaric chambers are now in St. Luke's. They are now in Singapore. Hyperbaric is not a cure for anything, but it is a very strong type of treatment to support many other treatments. So I think what is changing among the doctors now, but I think the patients have realized this even before the doctors, is that the patients want to do more, not just take medication. So this is where our program, we hope to help you understand what more you can do. So we shed some light on things like colonics tonight. We shed some light on how supplementation can work to support conditions, how in the worst cases where medical diagnosis can't seem to identify your problem, then your best hope may be to just keep strengthening your body until your body starts to heal itself. That is actually a real strategy. It's not a hopeless strategy. That's a real strategy. And increasingly, that is becoming the first strategy, right? So in Singapore, when you're diagnosed with borderline or mild diabetes, I forgot to ask Doc. He went off already, right? But in Singapore, when you're borderline, that means you're very mild diabetic. The doctors actually do not prescribe medication to you. The first, so for example, you do your blood test and the doctor say, okay, you have high blood sugar, you are technically diabetic, okay, but it's really borderline. The doctors will actually say this in Singapore. They will actually say, okay, change your diet, stop eating sugar, carbs, okay, and let's come back next month. Okay, if your blood sugar drops, then we won't put you on medication. But if it actually increases, then I will put you on medication. So that's a very different approach, right? Yeah, diabetic. The first solution is not drugs anymore. The first solution is some lifestyle changes. And if your lifestyle changes is effective, we can avoid the medication. So this is something that I think is growing. So I want to encourage everybody, those who ask questions tonight, it's quite related to this, that you're trying to find a non-medication approach to your illness. But again, you got to balance, right? I didn't remember my case is mild diabetes. If you are if you are serious diabetes, no Singapore doctor. Well, the doctor will straight away tell you, okay, let me give you an injection right now, okay, and bring your blood sugar down, okay, and then be on medication. But again, I think there's a growing awareness. So through our program, we are sharing with you what more you can do to improve your situation. Okay, what more you can do to improve your situation. Okay, so again, I speak hope to all the serious cancer patients out there. There's always a solution, right, to improve quality of life, and maybe even completely reverse cancer. So we are here with you from start till you find the healing that you're looking for. So see you guys next week. Have a good week ahead. Yeah.
Thank you. Thank you, Sir Sean. So once again, thank you for your questions and for valuing our program amidst your own health battles. On behalf of every patient here who watched us tonight, we want to express our gratitude to Sir Shyan Lim and of course Dr. Jansen Kalalan for pouring so much effort and care into all our questions tonight. Now, please keep informed and explore all available options. So don't forget to like and our Facebook page, Simply Nature International and Simply Healed Medical Group, and subscribe to our YouTube channel, Simply Nature. This is also, of course, to make sure that you get updated with our latest promos and exciting online and on-site events. Now, for exclusive website orders only, yes, you can still purchase our PPARS liquid extract and PPARS powder extract with no shipping fees. So whether you are ordering from Metro Manila or anywhere nationwide, you can avail this free shipping promo. Once again, this promo is only available via website. That's www.simplynature.asia. And of course, just a powerful double action deal for your health. This is the one that we wanted you to wait a while ago. If you purchase PPARS powder extract or PPARS liquid extract via our website, you can actually receive website and direct. You can get a free AD Pro serum. So this is combining internal cellular support with premium external skin nourishment. Plus, you enjoy the free shipping order, the free shipping promo if you order this via website. So back-to-back promo. Wow. So also, please stop struggling with stubborn eczema, psoriasis, or acne, and level up your skin game with AD Pro Probiotic Serum, because this advanced formula is specifically designed to restore your skin barriers and rebalance stressed out skin. The best part, our buy one, get one promo is still ongoing. So please, this is available via Shopee, Lazmall, our website, and of course via direct. So please hurry before this exclusive deal vanishes. Talk to your assigned CSOs. Okay, another great news is that we're expanding our hours. We are now open every Saturday, and you can visit us in our BGC office from 10 a.m. to 4 p.m. If you want to get an exclusive advice from a resident pharmacist, our Ms Jhen Macanjola, this coming Saturday, we have the Pharmacist's Choice. So she will be able to help you boost your immunity and cellular nutrition by elevating your health journey. So even better, if you buy our PPARS liquid extract once again, or the PPARS powder extract, not only that you can get the free AD Pro serum, but you will also get free umbrella if you order on-site, if you visit the office on-site. Okay. This exclusive promo is only available every Saturday lang in our office. So please get in touch with your assigned client service officer to know how to avail this exciting promos. So there. So we hope to see you next week for our next webinar of Simply Healed webinar. That's this upcoming July 9. Once again, same time, same day, Thursday at 7:30 p.m. as well. Thank you for spending your time with us. And once again, as we celebrate Nutrition Month this July, your resilience shines as a beautiful reminder of what it means to protect and honor our bodies. Let this month be a powerful catalyst for all of us to actively choose health, understanding that every wholesome, nutrient-rich choice we make is a step forward, reclaiming our strength and vitality. Choose healthy nutritional options. This isn't just a diet. It's our daily commitment to healing, thriving, and loving the life we are fighting for. So, and remember, of course, your curiosity about your health conditions, and your victories over cancer and metabolic diseases are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. See you next week, and God bless you all.